City Council workshop. We have Valerie Lovelace is on the phone. We're expecting Rob Pell to be absent, and I am expecting Brian De LaGrange to be here, but looks like he's running a little late. And we're going to start our meeting off today with something that's not on the agenda. We have a group of physicians here from Asante who would like to speak to us a little bit about what the situation is with the COVID rates right now. So Wynn Howard, if you would please come up. Can you make sure your microphone's on? It's a button right at the base of the mic.
Technical challenges, yeah. If I had $1 for every time I was on mute the last 18 months, I would be rich. I'd have to borrow money. So thank you all for allowing us to be here, and thank you for your service to the community and all the things that you do. We're here, wanted to share a couple of things with you this morning. It's a very desperate time. It's a very challenging time. We're in a healthcare crisis in our community, and I don't know if you all realize that. So one of the things I wanted to share with you is that if you go back to July 22nd, there were 32 patients hospitalized for COVID in Jackson and Josephine County. On the 29th of July, there were 62. Right now, as of this morning, there are 165 of those patients in Jackson and Josephine County. There are approximately, and we'll get the numbers from Laura here in a moment, there's approximately 55 in our hospital. It's a very challenging time. This is what I would consider the most difficult crisis I've ever experienced in my 25+ year career in healthcare. Today, I'm joined by a group of physicians and Laura Magstedt, who is our Vice President of Nursing for Three Rivers, and I'm going to ask her to come up next. Thank you very much. What's his name?
Good morning. Oops. Good morning, everyone. Thank you again for having us. As Wynn mentioned, we're in a really very, very, very difficult spot. I don't think we can underscore that enough. I think you'll hear that from myself and my colleagues. So I serve Asante as the Vice President of Nursing for Three Rivers Medical Center. And as Wynn mentioned, today we have 55 inpatients that are COVID positive. To put that in context, from our inpatient beds, that's about 50% of our inpatient beds are now filled with patients who have the COVID disease. Our COVID ICU, so our ICU is now 100% a COVID hot zone. So every single patient in that unit is COVID positive. That unit is full. It is over full, actually. So that is very striking. 100% of the patients that are in our COVID ICU are unvaccinated. Our med-surg units, as I mentioned, every bed is full in our med-surg units. Some of them are with patients that don't have COVID, as you might imagine. Lots of patients in the hospital for other reasons. But our occupancy is well over 100% at this point. We have expanded and we've canceled all of our surgeries unless they are urgent or very urgent or emergent. So all of our elective surgeries are canceled. To this point, it's more than 260 procedures have been canceled. And so those are individuals who are expecting to have different procedures that we are unable to do, given the fact that we need the space and we need the staff. We have a 10-bed med-surg unit in our PACU. So PACU is a post-anesthesia recovery unit. So you have surgery and you come out of surgery, and we have a space where typically people would recover. That has been converted basically into a med-surg unit. So the enormity of the volume of patients that we are seeing is unprecedented, is unlike anything we have seen. I'm sure Dr. David will talk about from our emergency department, but we continue to see huge record-setting volumes in our emergency department. And because of the space challenges that we have with our inability to accommodate every single patient in the spaces that we would typically on a typical day, we have patients staying in the ED that need admission boarding there for hours and hours and hours, days. So just really cannot underscore the challenge enough that it is quite real, and it is very scary. Our caregivers are tired and working many, many, many hours to try to care for our community the very best that they can. And so just a really enormously challenging time.
We have a question for you.
Sure, yeah.
Could you clarify, did you say 100% of your ICU COVID positive patients are unvaccinated?
That is correct, as of this morning.
Wow.
Correct. 94% of patients on our medical surgical units are unvaccinated.
If that's not telling, I don't know what is.
Yeah. Thank you.
Joel?
So I got to tell you, my wife was a registered nurse and worked with you a long time ago, and then got her nurse practitioner's license and has been a provider in the community for the last, 25 years. Worked with Dr. Moline, who was former chief of staff at the hospital, and Dr. Turek. I don't know if you know those names, but they...
Certainly Dr. Turek, I know, yes.
Yeah, they were from a long time ago. Our neighbor across the street is a registered nurse that works at the hospital, and morale seems kind of low. Are you having a hard time employing and retaining employees, including doctors and nurses?
So I can speak for nurses, certainly. Asante has not typically had a difficult time, hiring nurses. We hire a lot of new grads from RCC and from OHSU, and it's a very sought-after place to work. I think right now what's happening, you mentioned morale. I think we're trying to take care of this huge volume of patients, and our patients are very, very sick. As I mentioned, our ICU is 100% full. We've created a secondary non-COVID ICU that this morning has 1 bed left. So patients are just extraordinarily sick, and our staff are getting sick too. And so, we're not staffed to be, a 170 bed hospital. And so our staff are working extra shifts. And it's also very emotionally taxing for the staff to be in this situation. I have to say that just this weekend, there were a number of comments about, it's exhausting for them to take care of all of these patients, and given all the other things going on in the community. And so it's a difficult time for our nurses, our physicians, our phlebotomists, the entire healthcare team.
So what has been your attrition rate? Is it going up?
Our attrition rate is right about 10%. In context, the state average is about 12%. The national average right now is about 17%. So Three Rivers does very well, and has done very well in retaining staff. But this is an unprecedented time, So we'll see what happens in the future.
Yeah, I understand that. And the other thing my wife mentioned was, I think somebody went to the ER the other day, and the tent outside was completely empty, and the ER wasn't overflowed. Of course, it was early in the morning. The hospital does a good job of keeping things smooth. You don't see people running around adrenalized. You handle it in a professional manner. We do what we do, and you still do your triage and your medical care, which I appreciate. So when you go to the ER, if you see there's nobody else there, if the tent outside is empty, it doesn't mean that what you say hasn't happened during the course of any given day. And we need to take care of each other and ourselves. So. And just call it what it is.
Okay. Any other questions for me, or I know I have lots of
I have a
colleagues,
question for you or anybody who's capable of answering the question. As we know that the state has awarded some help from the National Guard. Can you elaborate on those kind of services that they're providing and how that's helping? And I'd just like to be up to date on that effort.
Yeah, so I'll tell you what I know as of this morning, is that they are non-clinical individuals that are being deployed. So they will help in all manner of things, whether that's helping to clean rooms, helping to wash dishes, helping to, bring meal trays up, helping to do, in our lab testing site, helping direct traffic, helping, we'll use them in lots and lots of ways. but they are non-clinical staff. My understanding from what I know from this morning is that at least the first group will arrive on Friday. I don't yet know how many exactly that will be in Grants Pass, but the first team will arrive on Friday.
Good, thank you.
Yeah, you're welcome. You're welcome. Okay, thank you.
Thank you. Was anybody else planning to speak?
Hi there. I'm Megan Frost. I'm a general surgeon with Asante. I also have a degree in public health, so I'd like to talk to you about two things. One, from a public health standpoint, you may hear us talk about what's called the R value of a disease, and that's essentially how transmissible or how infectious that it is. When COVID first started, the R value was around 1 to 2, and what that means is that for every one person that is infected, they will likely infect 1 or 2 other people. And that's in a population that's not vaccinated and unmasked. The R value of the Delta variant is approaching 8 right now, so that's showing how much more aggressive the Delta variant is. The other thing that shows us is that the vaccine is very, very helpful. So the vaccine is going to bring that R value down pretty significantly. It doesn't bring it to 0. The vaccine is not perfect, but like Laura said, our patients that are in the ICU, the ones that are really at risk of dying are the ones that are unvaccinated. Again, we have over 94% of the patients in the hospital with COVID are also unvaccinated. So there's a small percentage that's still vaccinated, but for the most part, they're not the ones getting sick. The other public health measure I'd like to talk to you about is the percent of positive testing. So currently we're about 20%. That means exactly what it sounds like. Of all the tests that are run in these counties, we're seeing about 20% of those being positive. The CDC considers anything over 5% to be really high. And what that means is that you have one of 2 things or both things going on at once. One, you either have a very high infection rate, which is what we're seeing, or you're not testing enough people. So it also would show that testing as much as possible is going to be helpful, because really when you're seeing that 20% predictive rate or 20% positive rate, what you're really then assuming is that there's a large amount of people that are positive that we haven't tested. It's kind of like the tip of the iceberg. It's only people that go to get tested that are showing up as positive. So if you're having 20% of those being tested show up positive, each of those can infect up to 8 people, then you still have a significant amount of the population that hasn't been tested that are also out there potentially infecting people. From a surgical standpoint, what I'd like to talk about is, Dr. David and Dr. Takali can talk about treating COVID patients, and luckily I don't have to treat COVID patients for the most part unless they need some type of emergency surgery. But the ripple effects of what COVID is doing to our community, I think, are immeasurable. So last week was one of the hardest weeks of my career. I called 7 patients with cancer to cancel their cases. So when you guys hear that we're canceling elective cases, this isn't hernia repairs, it's not hip surgery. We're canceling people's cancer care. In Medford, they're canceling people that need open heart surgery. So these are still cases that I would consider urgent, but we literally don't have the staff or the resources to take care of these patients. And when I call them on the phone and tell them we're canceling their case, I say, I don't know when we're going to be able to reschedule you. I don't know when we're going to have enough staff and resources to be able to take care of your cancer. And I honestly can't imagine what those patients are going through when what we're literally telling them is that you're not as important as our COVID patients right now. And the frustration that is happening with our patients and with our staff, one of you asked the question about how is morale, there's a significant amount of frustration amongst all of us that the vaccine could prevent how significant this problem is. It wouldn't take it away, but it would significantly decrease the amount of people that need our care right now in the hospital, and it would allow us to be able to take care of patients that have other medical problems that are very significant at the same time. So if I can ask anything of you, it would be to promote the vaccine as much as possible to those that you know, and masking. Masking is definitely important as well. Both of those things are going to decrease that R value significantly. Thanks, guys. Any questions?
Thank you. Any questions?
Hello. I'm Nicole Cowley. I'm the medical director of the Hospitalist, which is a group of physicians that round on patients in the hospital. So like Dr. Frost was saying, the last week has been probably the worst week we've seen. We had to call in additional providers to help us round on medical patients on the general medical floor and in the IMCU. With elective cases being canceled, the surgeons have actually started rounding on medical patients to help us, as well as anesthesia and other providers that typically don't see general medical patients. So it's not their area of specialty. So it's getting to the point that, the patient population just continues to grow and grow, but there's only a certain amount of physicians. So the last week I also called in traveling physicians that could help us with rounding on the floor. So we're just trying to pull and get help wherever we can get it at this point. In terms of the treatment of the COVID patients, there's nothing that's really been shown to be 100% effective in treating COVID patients. So, we're stuck with steroids and remdesivir, and these things haven't been shown to really help a great deal. It's really supportive care, oxygen, and it depends on how the people respond to the treatment. Some people respond to get better right away. It's hard to predict. Some people look like they're getting better, and then they get much worse, and they're on the ventilator by the end of the day. So it's a very, difficult disease to treat. I started getting more oxygen delivered to the hospital, running out of BiPAP or ventilator machines, that's definitely an issue looking forward. Any questions for me specifically?
Kurt, then Vanessa.
How about colonial antibody cocktails? What's your experience with those?
Yeah, so that they have been giving those in Ashland, and that's been shown to try to help prevent people from needing to be admitted to the hospital. I wouldn't be able to give the exact percentage of how effective that is, but I think it's definitely worth it if there's a community member that has COVID, that they're getting to the point where they're getting ill, to follow up with their primary physician and look at that option.
Well, it's anecdotal, but I have a friend who was high risk, went to Ashland and got better right away. So has Asante put in requests for higher stock level on that?
Higher stock, did you say?
Stocking of the...
Yeah, I know we did start the facility. It's through Asante in Ashland that's doing the monoclonal antibody, and I know Chris David can speak more to that too. When he diagnoses patients with COVID in the emergency room, he's been referring them to Ashland if they don't need to be admitted to the hospital. If they're not
So
sick
you can
enough to
only
be
get it in
admitted.
Ashland, you can't get it here?
Correct, at this point.
Is there a reason why?
I am not sure. Maybe someone else will be able to speak to that. Yep.
Thanks.
Vanessa.
I've heard twice now that last week was the worst week yet. Is it fair to say we have not yet reached our peak in this outbreak?
That's definitely fair to say, and we do have some graphs that show the kind of the projection of what we anticipate seeing, and I think over the next 3 to 4 weeks, we anticipate that this is going to continue to get worse.
Thank you.
DJ.
Would it be possible to get our hands on those metrics?
Yes.
That'd be great if we could get that sent to the mayor council so we have a visual of what we're dealing with.
Yeah.
Thank you.
Good morning. Thanks for allowing us to speak. I appreciate the comments. Thank you for talking about the ER. I'm Chris David. I'm the ER director for Three Rivers. Briefly, just to give you a recap, not to belabor too much of it, we are seeing record volumes in the emergency department, and that does inhibit us treating all emergencies that come in. We are having boarding as a huge issue. Boarding means there is nowhere for those patients to go immediately, so they can be stuck in our ER as a kind of secondary unit, if you will, for 15, 24, 48 hours, awaiting the next open room to come available. For instance, this morning we started with 15 boarders in our emergency department. We have a 28-bed emergency department with 2 psychiatric rooms, so 30 room total. If 15 of them are taken by patients awaiting a room, we can't get to many of the acute care that we need to do so. So we are still able to see the true emergencies at this point in time. but we're having trouble getting to everybody else that may have an urgency or a need or something that's going to turn into an emergency, and we have trouble actually seeing them. So wait times have gone up tremendously. Our tent does not look busy. We have limited hours on when we could staff it, because remember, we have to find extra staff to staff a new area, and we don't have the extra staff. So we're kind of piecemealing that together. But we're trying to keep most of the low acuity COVID patients that show up out of the ER, so we're preventing spread by doing so. So we're saying, hey, you can walk, you can talk, we're doing your medical screening exam, and you probably don't have any indication for admission or oxygen needs. Let's take you to the tent so you're not sitting in our lobby continuing to spread the disease. That was the instigus for the tent and where we came from it. The monoclonal antibody numbers needed to treat roughly are about 8 people to keep 1 person out of the hospital. So it's not a cure. A lot of misconceptions happen around the monoclonal antibody. It does not cure the disease. It tends to prevent the severity, and on people with the disease, it can help prevent them from being hospitalized, which is why we're using it. The evidence is only so-so in regards to the monoclonal antibody. It's an infusion, so it has to be given through an IV, and now you're taking someone who's COVID positive. You need to bring them into an institution, put them in a chair, and have them be there for a few hours, so it has to be done very carefully, and it was determined that Ashland was going to be the safest place to do so. That had the facility with a backside entrance that they didn't have to go through the hospital and whatnot, and that's why it was chosen to do it at Ashland. And I know that's not a great convenience to Grants Pass, but that's the option we have. And at this point, we have lots of, well, I should say, enough monoclonal antibodies so far. We have not had a paucity of that as of yet. Any specific questions that you have for me?
Any questions? Vanessa?
Now, I know you're not a representative of AMR, but have you heard of any difficulties with COVID transports and availability of staffing also for that agency?
Unfortunately, COVID does knock out some of our own staff, and that's both the vaccinated and the people that are skeptics and don't vaccinate. And so a lot of them have had short calls, meaning they don't have enough people to run everything. And that's probably been more predominant than actually not having difficulties with transport. They've got that down, and we've got a lot of practice in gowning up and having the right protective gear and making sure we transport as safely as possible. But it has taken out a lot of our staff, including our nursing staff in the hospital, which leaves us short staff for the more record number of patients. So you can see the equation and how it's been taxing on a lot of the nursing staff and paramedics and techs and AMR as well.
Thank you.
Thanks.
Thank you.
Good afternoon. I think I am the last to speak. My name is Scott Nelson. I think the reason why I was chosen last is I'm a colon and rectal surgeon, so I'm always bringing up the rear. I am the immediate past chief of staff for Three Rivers Medical Center. I also serve on our community school board with Brian D. LaGrange. It's an honor to be here. I do thank you very much for your service, and I sincerely mean that as one of you who serves our community. I've lived here for 12 years. We love Grants Pass. I have raised many children here. I still have 4 that are in our schools. The others have talked about what we're seeing, and all of that is true. We are seeing COVID infections in unprecedented numbers. I'd like to speak a little bit about where we're going in the future. We have modeling from OHSU, which is concerning. We don't expect to peak with this until early to mid-September. I was in a Zoom meeting this morning with the school administrators as well as the Josephine County Health Department. Dr. O'Keefe was mentioning that we are now #1 in the state of Oregon as far as our infectious rates in Josephine County. Our county had 800 new cases last year, so per capita that is the worst county in the state of Oregon. If you imagine 800 new cases that were diagnosed last week, we don't typically see them coming to the hospital for a week to 10 days. So if that number continues to grow, and we are already at an overcapacity, just imagine 10% of the 800 who will now show up and need care, and it will just exponentially increase over the next several weeks. I think you can understand why our concern as we're here talking. I would echo the sentiments of my fellow colleagues. Vaccination is our best and most protective way to help our community. I know we live in a very independent place. But that really is where we need to go, and we would certainly implore your help as a city council and as a city to continue to promote that as our best way, followed by masking and social distancing. This is not the same COVID that we saw before. This is real, and it is concerning because people are very sick and dying, and we will continue to see this in our community. So again, I appreciate your time. I'm happy to answer any questions. We will provide the modeling for you as part of our package so that you can look at the data that we're getting, and then also just the reality of the numbers that we're seeing from last week and what that will be predictive for our community. But this is something that is of great concern to us, and we appreciate very much your time and letting us come and present this to you, because this is something that will continue to affect our community for several months, if not longer, but certainly this crisis is going to go on for long. So I'm happy to entertain any questions you have them, and if not, we will allow you to get to your regularly scheduled programming.
Go ahead.
So currently, how many children are in the hospital with COVID?
So we do not have any here because we don't keep them here. If children do present and need admission, then they will be shipped down to Medford if they have availability, or they have to go up to Dornbecker. Children have historically not been affected to the point where they need to be admitted to the hospital. However, I caution that we look at it that way. I will just speak anecdotally, so this is not evidence, but I was speaking with our radiologist this morning. He was reading the chest x-rays from last night, and he had 2 children that had come in during the night with chest x-rays that were COVID positive with pneumonia. Dr. Marshak was not able to join us today. He's one of our pediatricians in their office. They are seeing an exponential increase in children who are testing positive. I think the concern is that previously they didn't seem to be spreading the disease. We do not know what that will look like for children now with this new Delta variant. But it is true that the children are starting to show up in our community with pneumonia and symptoms of COVID, and we have not necessarily seen that before. So I'm not sounding alarm bells, but it is certainly a concern that we are seeing some of that now.
Calling our area independent was very tactful. And I suspect that in another month, if we have a number of kids coming in with COVID, that they may wear way out of that.
Well, we are an independent group here, and that is what, we pride ourselves on, and that's fine. I don't know that that serves us well in a pandemic, but that is certainly who we are as a community, so.
Jay, then Joel.
So it's unfortunate we have a lot of information about this. One thing that I hear often from people is the idea of a herd immunity regarding COVID. Could you speak about the herd immunity mentality in concert with COVID?
Sure. With regards to a number, so historically, herd immunity has been considered to be about 70% of a community needs to be immune to a disease in order to protect the herd, if you will. I do not know exactly where we stand. I guess if we want to talk about some positive rates, so as I talked with Dr. O'Keefe today, I believe that our community immunization rate in Josephine County was just crossing 50%. It has been trickling up by 0.3 or 0.4% per week. However, over the last 2 weeks, it has jumped to 1.5% increases. So that is a significant jump in a population. And I do think that the word is getting out that this is real, that people need to be concerned, and that vaccination is the best way. And so that was very encouraging to me to hear. That does not necessarily mean that this is still not a crisis. We need more people to become vaccinated, or unfortunately to become ill. That is how we will reach herd immunity. And I guess there's an easy way and a painful way, and we may be going down the painful route, but certainly we need to hit about 70% as that magic number, and it may need to be higher than that, but we are still a long ways from that. So,
Joel?
Well, I appreciate you being here, Dr. Nelson. You're a good ally and a member of the community, and we obviously respect you. Echo and Foxtrot variants. A lot of people around the world have it. Virus is famous for those type of things. A lot of unknowns. People have expectations for the future, what the future looks like. From your vantage point, what does the future look like with future variants, and how do you feel about it?
Well, I appreciate the question. I failed crystal ball reading in medical school, so that is a difficult one for me to answer. I think the honest answer is we do not know. Maybe that's just where we need to be honest about what we do know and what we don't know. We didn't know a lot about the Delta variant, but it's here, and boy, is it something. And what other new variants will look like, I don't know. I certainly hope that we don't see anything like that. But so in answer to your question, I really don't have any information on that. I can only talk really about what we're seeing now, and it's scary enough. I hate to think of what else could be coming down the road. So,
Vanessa?
I'd like to say thank you all for coming here today. I know you guys are really strapped and really busy right now, so making the time to come here and sound this alarm, I'm really thankful for that. I'm hoping the more we get professional voices on the front line of this discussion, the more we can hopefully push out misinformation. So I'm hearing that the City Council can help support by promoting vaccinations, physical distancing, and masking. Is there anything else that we can do to support you?
get your colonoscopy? I'm just kidding. No, if we could do that, I think part of our I think our mantra really needs to be that we are a community. Part of this is not just the independent nature that we all love. I know that we all feel that we have our rights and our freedoms, and we certainly do, and I love this country, and I'm grateful for those things. But this really is a time for a community to come together and to think about not just ourselves, but about everyone else. And how can we help our community be safe? And that is a message that I think has been lost over the years. I don't know if it's social media. I'm not going to pontificate on my own personal opinions on that. But we seem to have lost that community spirit of wanting to help and serve one another. And if there is anything that we can do, I think it is to speak about that as a city council, as about a city that we are GP. I love that mantra that came from the school district. We are GP. We need to be a community. We need to act together as a group of individuals who are caring for and watching out for each other. And we need to allow, I think, the politics to stand aside. This isn't about our freedoms or our rights. It's about taking care of one another. And I think if we can change that dialogue and change that vision of how we act and behave, it will go a long way for us to protect ourselves and make our community a better place. So that's really it. I think masking and social distancing and the vaccine, those are the physical, tangible things that we can do, but it is also speaking differently and having a different attitude about how we view the world. And that's a much more difficult thing to, I think, expel to the world at large. But that's really where we need to be as people and as a community. And so I would just encourage us sincerely to think and look at the world differently and encourage people to do the same as we're striving to protect ourselves and each other, our friends, our neighbors, and our community. So anyway, very grateful for your time. Thank you very much. We are honored to serve our community. If I can just close by reassurance, you have a wonderful medical community here who are dedicated to taking care of each and every one of our community members, and we will do the very best that we can to manage this crisis, and we are continuing to do that, and so you can at least rest assured that you have excellent people over there who will take care of the individuals within our community. So thank you very much for your time.
Thank you, Dr. Nelson.
So thank you for allowing us to be here and share with you. I mean, you can see that we're very deeply concerned. And quite honestly, there's so many members of the medical community that wanted to come this morning, we'd have to build a new building to be able to provide who all wants to speak on behalf of the concern that we have right now. A question I have for this group is there any value in us coming to your meeting Wednesday night? We will do anything we can, anywhere, to get the message out.
I think if you feel that we still need to get it out to the community, and we do have a number of people who watch these meetings, I'm certainly willing to open it up to you again if you feel that it would help. We've been, it's not necessarily just for us. I think that we all, are vaccinated and wearing masks, but we do need to work together to get this message out to the community. And Yeah, thanks for coming here. Obviously, very powerful messages that you have. Especially appreciate there at the end what Dr. Nelson said about building community, and that this isn't just about independent decisions and making decisions for ourselves. But I have members of my family who have experienced breakthrough cases because of being exposed to unvaccinated people who were ill. And I don't appreciate that, you know. So it's been a tough situation. I think I have personally been extremely concerned about this for the past couple months. I'm glad that Asante is becoming more vocal and visual about speaking out to the community. I think we've been missing that. And I'm glad that you're here now. I hope that our county commissioners will join us as well in continuing. They have been resistant so far to encouraging people to get vaccinated, and I've been asking if we could get the state money to promote vaccinations in lieu of the county receiving it, and I've been getting a whole lot of runaround. Unfortunately, the county commissioners could have received these funds 2 months ago, and they declined to do so. And now, you know, I'm happy to work with them as long as they're working with us, you know, but the most important thing is not who gets the money exactly, but that we get the message out to the community and help get people vaccinated. And it's been a very, very frustrating situation. I'm sorry that a year and a half into this, we're still in this mess, and that it's worse than ever. Thanks for all of what you do. I know it's hard day in, day out. Your staff has to be exhausted. It's heartbreaking. So thank you for being here. And I know that takes a little bit of our time here, but I will welcome you back Wednesday evening.
Okay, we'll be happy to be here, and I applaud you also for being willing to accept that money for the vaccine awareness and all. And we are also very willing to be thought partners with you about how to best utilize that to help get it out there, because it's extremely important for our community. So the team here that's with me today, you might see a couple more folks as well, but we're happy to come back, and we will be meeting with the county commissioners in the morning. So thank you all very much.
Thank you. Thank you for all you do. And Valerie on the phone says that she wants to thank you as well.
Yes, I'm up in Portland, and speaking of the vaccination numbers, 77% of the people in Multnomah County are vaccinated, and they are not seeing what Southern Oregon is seeing. And I think that just makes a huge statement. So thank you so much for coming and helping to get the message out that vaccinations make a difference.
Brian?
Yeah, I just wanted to thank you all for being here and for letting our community know how big of a crisis this is. I'm frustrated, and I don't work in the medical profession, so I can only imagine how frustrating it can be for you and your staff. Thank you for trying to help get the word out to us, and especially to the county commissioners. And then I would ask the mayor and the council, I know that we're doing everything we can to get that money to help promote vaccinations. But are we doing everything we can? I mean, is there anything more that council can do? Can council sign a letter to the governor? Would that help us to expedite getting that money here? Or I know, Mayor, you've put in a huge effort on that, and we all appreciate it, but is there more that the council can do to kind of help bolster you in that?
Could be. DJ has an idea.
Yeah, so on that note, when COVID started to become an issue, we had declared an emergency clause, which primarily gives the city manager more flexibility regarding expenditures and contracting. It also sends a message, politically increases awareness that we're aware that we are in an emergency. So I would like to entertain suggesting reinstating that emergency clause declaration. If for any other reason to increase potential flexibility for the city manager and expenditure, but also, like I said, to promote awareness of the issue that we have.
As far as the letter goes, yeah, let's do that. Maybe I can draft something we could have available on Wednesday night for you guys to take a look at. Did you want to speak again?
Yeah, that would be great. And then to what DJ said, that sounds great too. I would like to see what the details of that are before fully voicing support for it, but initially I think that's a great idea.
All right. Thank you again so much for coming, and hopefully we can get through this sooner than later. All right, council and our audience members, thanks for your patience. I know that we have a big agenda here today of city business, but obviously what we've got going on at the hospital is extremely important, and in some cases literally a matter of life and death. So wanted to take a moment there to hear what they have to say. First up on our agenda is Climate Task Force, and it looks like Jason Kennedy is presenting.
It is. Thank you, Mayor and Council. That's got to be one of the toughest presentations I've had to follow ever. So today we do have another fairly large and very relevant topic to tackle, and that is to present options for the potential formation of a climate task force, some potential membership options, some potential work plan items, and future potential formation of a climate advisory committee. And the relationship to your council goals is enhancing opportunities to promote character and community spirit, create a climate task force or committee. And this was a 3-star item coming out of strategic planning this year. So during strategic planning, the council indicated a strong desire to create a climate action task force or committee. So to kind of put those into perspective, task force really is short-term, generally has a single point of focus. They go in, they get a job done, and they move on after giving you a report that you can then take action on. A committee is much more longer term. They may still go in, take action, get that report generated, but then they stay on board and they help to monitor the progress of that, provide council with additional details similar to many of your other committees like bikeways and walkways or parks advisory committees. Some potential task force and committee duties could include the conducting research on climate change actions. What can we do? Advising the city on sustainable practices. How can we be more efficient? Creating a climate action or sustainability action plan. Engage with the community on sustainability options. And then also, if this would be for a committee, only a task force again would be shorter lived. Monitor the progress of the plan and provide regular updates to the county to the council on this, of how much we've gotten accomplished. So a climate action plan is a detailed framework measuring, planning, and reducing greenhouse gas emissions and their potential impacts on climate change. It would include a baseline study. How much greenhouse gas emissions does the city currently have? It would have an emission reduction goal, so it would set a target for us to reduce that emissions. It would also set a prediction for the emissions increasing under a business as usual strategy. So if we do nothing, what will our gas emissions be 20 years from now? It will also present a suite of strategies, programs, and steps to achieve those desired reductions, and address how future state and federal regulations would be implemented as part of that action plan. There is quite a bit of work that we've already accomplished that would likely be, that would have been included in a climate action plan, and I want to go over some of those because some of them are pretty important. The heat exchanger at the water restoration plant. This is moving from using natural gas to heat the digester to actually using the digester gas to reheat that digester. So it's kind of a almost perpetual motion, but not quite. This is huge because it's going to cut our gas usage or our gas emissions by half. So instead of burning natural gas and burning off all the methane, we are not going to burn any natural gas and only burn the methane. So that's a net gain. The extensive use of hybrid vehicles in the city, as well as evaluating electric fleet options where those might make sense. The electric vehicle charging station project that is kind of stalled out, but we are working very diligently to try and get a contractor back on board. The installation of solar panels on the public safety parking structure. This was another very major one, and this is the conversion of streetlights from incandescent to LEDs. This reduced our energy consumption drastically on our street lighting program. The addition of the urban forester to monitor the health and welfare of our urban trees. This is increasing our carbon absorption potential, as well as having great benefits by slowing the flow of stormwater into the system. So one of the things that you need to decide is what level of plan that you would like to take and what tasks you would desire that task force to advise on. So the creation of a climate action sustainability plan could be limited to city operations. We could look at what the city does, what actions we can take as a city, and deal with that. That is a much smaller task, although it's still very major when you look at the entire breadth of city operations. You could also create a climate action plan or a sustainability plan that looks at potential policy changes that affect all city residents. This could include things like how planning reviews new commercial and residential developments, tree canopy requirements, alternative fuel discussions, and perhaps maybe this would be a long-term goal of a potential committee. For a climate action and sustainability plan to be successful, we really need community involvement. This has to be cut across all sectors. The city will want to engage a very diverse group of both technical resources and lay people to help guide the city's future sustainability efforts. Engagement of local educational institutions will also promote that educational focus of what the task force is all about. So I included this slide. When we met, Councillor De La Grange and Councillor Auger and Mr. Bradbeer, who would like to come up and speak at the end of this at the end of the presentation, we came up with a potential list of members. And that's not that all of these would be members, but these are people that we should choose from within the community. And I wanted to put that out there for you for your consideration, were we to come back and form a committee or a task force at a later date, of who you think we would want to include in that potential task force. And as you can see, that list does cut across almost all sectors of the community, including education, city staff, higher education, other government partners, which are very important, and then the business and professional development areas. So why climate action? I've included a presentation from Mr. Bradbeer in your packet today that really goes into a lot more depth of why, but this graph really does kind of sum it up. The temperatures are warming when you look at global temperatures, and they are not only warming, but they are warming at a fairly significant rate. And as humans, we need to do something to try and correct that. That's what this really boils down. That warming is leading to drought, and not just a little bit of drought, but fairly extreme drought across the West. You just have to look outside. This year alone, it's pretty hot, it's been pretty dry, and we're not seeing any changes in that in the near future. Winters have become very volatile, where we don't know if we're going to get rain or not. And then that is leading to extreme wildfire situations. And not only are these wildfires now out in the woods, but now they're coming into the cities, which has really been unprecedented in my memory. I've never remember fires hitting urban areas, and now it's happened 3 times that I can think of in the last couple of years, and that's pretty amazing. And so that's another reason for us to take action on this item. So how do we do this? Well, as you all know, resources are definitely stretched thin. There is a program offered by the AmeriCorps Group. They have several programs, one of which looks particularly opportune, and that is their RARE program, Resource Assistance for Rural Environments. It is an AmeriCorps program administered through the University of Oregon. They can provide a full-time person for 11 months out of the year to work with the city towards creation and implementation of a climate action plan. In addition, they could be the liaison to the committee, they can do all the public coordination, they would be an extension, they would just be an additional staff member for those 11 months. The city would need to provide about $23,500 to place, train, and support that person for that year. In addition to square footage, computers, there's a bunch of other little charges that go along with that. So again, it would depend on the scope and the recommendation. However, you can see from this slide that the Rare Corps member could fit in either direction. Just the scope of what they would be needing to accomplish in that first year would be highly variable. If the plan is exclusive to city operations, the task force working with a Rare Corps member could create a plan with actions for staff to implement, very similar to how PAVE works. We would come out with a climate action report. Staff would then report back to council on a regular basis on the actions that have been taken to comply with that report. If the plan is for more widespread implementation, the task force working with a Rare Corps member could work with a larger community stakeholder group to create a sustainability plan with much more actions, including potential code or development code changes, voluntary or required citizen actions, awareness training activities, or more. It really just depends on the level that the council would like to choose to tackle. So cost implications. They are very variable. What I can say is Public Works Department does not have staff resources to work on this right now. And just, we are strapped with everything that we have going. So if we are going to move forward with this, it is really our strong recommendation that we would utilize the Rare Corps to facilitate this work. That would mean that we would need to allocate $23,500 from some source to be able to do the meeting facilitation, help create the plan, potential code modifications, and implementation of any recommendations. We would recommend that we create a total budget of at least $50,000 per year for 2 years minimum to get this program going. And that extra $28,000 would help to fund office space, meetings, some consultant time to help with the plan creation, et cetera. So potential funding sources. So I wasn't just going to tell you how much without giving you some options as to where those funds could come from. We do have project number LB6413, which is the Municipal Building Capital Asset Plan, also a 3-star item, and it is currently budgeted at $525,000. We think that this will need additional funds, but we are in the process of reviewing the RFPs, and we will have a better handle on costs here in the next 30 days. We will know who the selected consultant is, and we'll be negotiating a fee with them. But that is one potential option that would get this a little bit fast-tracked. It is important to note that the period to apply for the Rare Corps member is April of next year, so we do have a little bit of time. We did miss this year's window. The other thing is that this could be funded through our Fleet Services and Facility Maintenance group. And I know you're going, well, that seems really weird. However, if you think about the outcomes of a city climate action plan, most of the actions are going to be related to restructuring buildings and energy efficiency in our buildings, as well as energy efficiency in our rolling stock, for the most part. The other reason that these two funding sources are a good potential is they do work with all of the other departments, so those departments could be charged an equal share to help fund this across there. The other option would be the general fund. However, as Adam will, he's already glaring at me, it's hard to see it through the mask, but the general fund, as you well know, you guys did an exercise cutting $2 million. There is no dollars there to find for this project likely. So these kind of are our options. So this really strictly at council's discretion. The alternatives would be to direct the city manager to form the task force and explore the climate action sustainability plan, in which case we would come back to you at a Wednesday night meeting with a tentative formation document that would, I believe we have to pass a resolution to form a task force. Yep, I just got the nod from the boss. And that would be a pared down group to examine how big we want to go. And we could form a group, get that project going. You could also direct the manager just to form a climate action committee and start right out at the committee level and move forward from there. And with that, I was hoping that you would allow Mr. Bradbury to come up and say a few words. He has been very instrumental in helping me get this presentation together, is very passionate about this subject, and would be a huge asset to us as we move forward.
Yes, we are planning on having him speak. Thank you.
Jason, thank you very much, Mayor, Council, staff. I'm delighted to be here today, although that previous discussion was very disturbing. I still feel moved by it, and it's hard to move past it. Just had to say that. Thank you, Jason. That was a really good introduction to this topic, and I fully support the proposal to establish either a committee or a task force. And the reason for that is that the Earth's carbon cycle is clearly out of balance. Human activity is adding more greenhouse gases to the atmosphere than can be absorbed by the absorptive capacity of the oceans and the forests. The resulting increase in average temperature pose a threat to our way of life. We need to address that at every level. The printed handout that was made available to you today is a summary of the data supporting the hypothesis. I'm not going to go through all of that. The data shows that human-caused greenhouse gas emissions are accumulating in the atmosphere at a very rapid rate. The resulting impact on average annual atmospheric temperatures is also documented in that handout, and the environmental stress created by rising temperatures is exemplified by the data on drought and wildfires. The solution is to reduce greenhouse gas emissions and increase the absorptive capacity of the oceans and forests, including our urban forest. I believe this is a really important element of attempting to rebalance the carbon cycle. We need to increase the absorptive capacity of our forests and the ocean, including our urban forests, as we reduce our carbon emissions. I think they go hand in hand. Local action is needed. The proposed task force or committee will provide a resource for managers and the council to reduce municipal emissions and increase the absorptive capacity of the urban forest. These are the local actions which the council has both the authority and the responsibility to plan, initiate, fund, manage, and ultimately to achieve carbon neutrality. I have a whole lot more here about the role of the committee. I think Jason has done an excellent job with that, and I would urge you to take action to establish a new advisory committee.
Thanks, Tom.
Thank you, Tom.
Council, do you have any questions for either Brian?
Thank you, Jason. Thank you, Tom. I had a question about the rare member that's provided by AmeriCorps. Is that a one-time thing, or is it something that can be reoccurring?
I think we can reoccur, but I didn't see much past 2 years. So we might be able to get 2 years. There might be an option for a third, but 2 for sure I think we can get.
Okay, thanks.
Yes.
Joel?
Good sandwich, excuse me. So the Environmental Protection Agency and the Department of Environmental Quality have vast resources, and they've looked at this issue, and we don't need to reinvent the wheel on some of that stuff. So have we, maybe that's what the task force needs to do is look at what's being done at those levels, because we don't want to reinvent the wheel. We don't need to do our own, at the extreme, individual research to see what's going on or try to interpret what is true and what's not true. Because that can be a rat hole that swallows up a lot of resources and isn't very productive. So I would just encourage, as we move forward, that we recognize that and not make it into a political issue. It is a scientific issue that there's a lot of information and resources out there, and we can make good political decisions on it and go from there.
Any questions? All right. Guess we don't have any questions. Just open it up to council discussion. What would you like to see happen with this? Vanessa?
Thank you, Jason and Tom, for all of your work on this topic and bringing this presentation forward today. I think this is a perfect example of thinking globally and acting locally. And I wanted to talk a little bit about the Hood River Energy Action Plan. I was in touch with an AmeriCorps employee through that program, through the city of Hood River, and I think one of the exciting things that came out of their energy action plan was they were actually able to solarize their public pool, and it was the largest grant-funded project in state history. So I think that's just one out-of-the-box example of how we could become carbon neutral and how we can move forward with climate resiliency. There were some questions about how to move forward, and I would prefer to see a committee established versus a task force. I don't see the trajectory of our climate change changing. Fortunately, the trajectory is exponential, not linear, so I would like to see a committee that stays around rather than sunsets. And I would like to learn more, Jason, about funding through fleet services and facility maintenance. The argument that you made, it makes sense. And I think it also outlines what the term green jobs really is. Oftentimes when people talk about green jobs, we just think that's building solar panels or windmills, but it's actually, you know, providing energy efficiency for homes and things like that. So I think those are the two questions that you had. And that's all I have at this time.
Valerie?
Yes, I'm going to support what I've heard. I will say that ODOT has a lot going on right now with sustainability. So there's a lot of information that will come down through ODOT and through the state that I think we can feed off, just as the DEA and the DEQ. So there's a lot of information out there. In the very beginning, I am going to support commission, not a commission, but a committee or a task force. I think that I'll leave that open either way. But that would be our first step, and let them look at what's out there and see whether the rare AmeriCorps member would be appropriate. But if so, once again, I support what Vanessa said, that the municipal buildings and fleet services are both places that I would like to see the funding come from.
Joel?
The other thing that I would encourage us to look at, and it's just a comment, urban areas are hotter than rural areas. I see it every day when I go out in the woods and my car tells me what temperature it is, and I come back into Grants Pass and it's 5 to 10 degrees warmer. And there's a reason for that. So just as an urban area and livability, regardless of what's happening globally, that's happening locally, and it affects people and the environment they live in the city, or the environment they live in the rural areas, so that it's a lot cooler out there than it is here. Not a lot cooler, but much more tolerable. The other thing is the integrated ecosystem and the water and water temperature. And that's mainly affected by, in the Rogue Basin, not by necessarily the air temperature, but by the elevation, because you get warmer as you come down lower from Crater Lake. The water will automatically warm up just like the air does. And the other thing being water withdrawal and water input, groundwater input. And so if we have everything going on concrete directly into the Rogue River, it's a flash event where you increase your peak flows and you decrease your base flows. And so the water gets hotter in the summertime. And I don't know if this can address that or not in terms of what we can do as a city locally. It's not a, both those things are local conditions, they're not global conditions. And they're both important to us, so.
Brian?
Yeah, I'm really excited to see this finally come to council. I think this is a really great opportunity in a lot of ways. I think it's a great opportunity for the city to streamline its operations. I think it's a great opportunity for the city to save money on their utilities, on their fuel. And I see a committee kind of focusing in that area first. And it's almost kind of like an onion, to where the committee, first looks at what we're doing, and then once the committee, works through all that and has all those recommendations for what we're doing, and as we become an example for the community in that regard, then the committee can work towards helping other community members and partners in the community to do the same thing, so that we're not only saving the city money, but we can also save our constituents money. We can also save other local partners money and streamline operations throughout the community at all levels, really. So I'm really excited that this first step is happening.
DJ?
I think a task force is prudent. That would provide the opportunity for constituent input to chew on all the things that were just demonstrated to us today. That can come back with us, gather the information, gather community interest or otherwise, and the next logical step would be a potential committee and budget allocations. But I'm in favor of creating a task force in the short term to help advise about the more long-term directive.
Somebody want to make a motion?
I move to create a committee, climate, oh geez, what's the word I'm looking for? Climate task force. Yep.
Is there a second? Joel, discussion on the motion? All right, so the motion is to create a task force rather than a committee. DJ, how do you vote?
Yes.
Vanessa?
Yes.
Kurt?
Yes.
Joel?
Yes.
Brian?
Yes.
And Valerie?
Yes.
Thank you. All right, we'll go ahead and start working on a task force, and then perhaps that will morph into a committee.
Yep, thank you.
Okay? All right. Next, first, just a little announcement. Our presenter on the Lawn Ridge, Washington Conservation District had to leave, so we are going to be skipping that today, but next up on our agenda is the System Development Charge and Construction Excise Tax.
All right, good afternoon, Mayor and Council. This is a topic that you have had, I think I just looked back at the documentation. It's been discussed since about 2018 at various times, but you did ask for an update and an overview. I think this is the first time that the council since January, the newly elected officials have had this, so we're just going to. There's a lot of words in these upcoming slides. I'm not going to read all of it. You did get them in your packet ahead of time. Try to hit kind of some of the highlights. We do have Doug Walker here today, who is the chair of the Housing Advisory Committee, who we weren't expecting, but surprisingly he could come, so that's great. So he's here to speak on this matter as well, and he has been with Housing Advisory Committee since the beginning, so he can give you lots of history there. So this was a council request to have the construction excise tax put before you, and it would assist with the development of affordable housing, including the payment of system development charge exceptions. A little bit of background, this was authorized in 2016 by the Oregon State Legislature at the same time that the incentive inclusionary zoning was now added. Joining. Both of those were sort of tandem with Senate Bill 1533. We are not looking today, this is focused just on the construction excise tax, not the inclusionary zoning, which was the other piece of 1533. So it would provide the option to implement a CET to help pay for affordable housing programs. That really is the primary focus for why the legislature chose to adopt this legislation. It's a fee assessed based on a percentage of the permit value or the approximate value added to new construction. So it's all tied to whatever the valuation is of a permit. That's how the amount of the construction excise tax is determined. In addition to that, the legislation says that jurisdictions can have an administrative fee to administer a program, a maximum of 4%. We currently do administer the programs for both Grants Pass District Number 7 as well as Three Rivers School District. The agreements were entered into at different times, and so we actually have different amounts there. So the administrative fee is 1% for Grants Pass School District 7 and 4% the maximum for Three Rivers. This is one of those slides that I won't read all the way through, but there are in the law several exemptions from what types of construction can be charged at construction excise tax. Largely, they include school-related projects, senior centers, religious facilities, agricultural buildings, things like that. So it is divided up really into two areas. You can charge it on residential and you can charge it on commercial industrial. There are a few different rules depending on which one you're talking about. So for this first slide here on residential, you can go up to 1% of the permit value for new development. This only applies to substantial additions or new developments. So if you're just doing, you know, sort of your routine maintenance on a house or something, you would not be allowed to charge a construction excise tax. The revenues net of that 4% administration fee that I mentioned must be divided into three categories: development incentives, down payment assistance, and then a broader category, but it's really affordable housing related. And then here's how that breaks down just a little bit more detail. 50% for the development incentives for affordable housing. You can use it for things like fee waivers, finance-based incentives. The 35% is other affordable housing programs that wouldn't necessarily be incentive-oriented. So that could be grants for rehabilitating affordable housing, existing affordable housing projects. It's a pretty broad range. Eugene and Corvallis are two examples of Oregon cities that have had CETs for quite a while. I believe Eugene adopted in 2019. So there's, you know, some examples of programs out there that we can look to for some guidance. And then on that last 15%, that goes to the Oregon Housing and Community Services, the state agency for down payment assistance. So that was the residential side. On the commercial side, there is not a 1% limit. It does not set, the statute does not set a limit on that. And then you have a little bit different categories in terms of how you can spend the commercial CET revenue. Development incentives is still one of those, and then, but 50% is unrestricted and allows for a lot of flexibility to local jurisdictions on how you can use the revenue that's generated. So we did do an updated analysis for you today that is updating some numbers that were given a couple of years ago to the council. I should mention here that Housing Advisory Committee did make a formal recommendation and motion to the City Council back in 2018. The council at that point chose not to proceed. But they had a fairly detailed recommendation at that time, and Doug can maybe talk more about that. But that looked at a little bit less, you know, revenue generated, obviously, because the permit values have increased. The CET would apply to new construction, expansion, or remodel of non-habitable space valued at over $30,000. Again, this is all up to the council's discretion on these numbers. So that $30,000 is what we used to calculate and get these numbers. And it also assumed a 0.5% for residential and 1% for commercial. The cap on the CET is determined by council, and these next couple slides do assume a 50,000 cap. And our 2 school districts currently have a $25,000 cap. That's in the statute. So what would it generate? The table here behind me shows you basically if your permit is valued at $30,000 or less, there wouldn't be any under this recommendation, or I'm sorry, analysis, building off Housing Advisory Committee's prior recommendation. And then you can just kind of see how the gradient changes there. If you come in at a $250,000 permit value and 0.5%, it's a $1,250 CET. That is in addition, of course, to what is being paid to the schools. The commercial and industrial side, we applied a 1%, again, using a $30,000 base and capping it at 50,000. So on CE for the commercial residential, the commercial industrial, here at that 1% is where you're coming in at. So if you had a $450,000 permit for a retail building, for example, you would be looking at a $4,500 CET. And here we put side by side just so you can see, this is each year you're going to see different numbers because of the different valuations. So we just showing you 2019 and 2020, what the total valuation is on each of these, residential, commercial, and then total. So you can see 2020 was a pretty substantially different year, but 2022, 2023 could be well below 2019. So it's unpredictable. At those numbers there, the projected revenues are $345,000 for 2019 and $486,495 for 2020. Again, using the 0.5% for residential and the 1% for commercial. So that's kind of where we're at. The SDC piece of this presentation we didn't spend a lot of time on, but I think the council's already had some presentations on how that might work. The revenues from this could be put in towards assisting with SDCs. Cost implication is really to be determined, as well as the call to action. So you could direct staff to prepare an ordinance to proceed, move to an additional workshop, or don't proceed with a CET.
Thank you. Any questions for Brad before we have Doug come up? DJ?
I have a question about that 15% to the Oregon Housing and Community Services. So that's presuming that this vehicle for taxing is utilized, right? Let's entertain if we did a affordable housing tax levy or otherwise put it on the ballot for people to vote in something like this. Could we circumvent that 15% contribution?
Are you saying if we're talking about other than construction excise tax?
Yes.
Yes. That's specific to the CET legislation.
Okay.
Any other questions for Brad? Brian?
Yeah, thanks, Brad. I just had a question on the, there's types that are exempt from the CET, and one of them is public and private hospital construction. And I was just curious, because I know there's a lot of medical construction that isn't necessarily a hospital per se, like outpatient centers, doctor's offices. Do you happen to know how, is it strictly hospitals are exempt, or is it kind of a broader category?
I'm sorry, I do not know that technicality. I don't know if Aaron does or not, but.
Yeah, I'd have to really get to your answer. I'd want to really explore the true definition of what that is, but it does exempt some of it.
All right, thank you.
All right, Doug? I think on behalf
Hey,
of...
Sarah, this is Rob. Can you hear me?
Oh, hey, Rob. Yeah.
Hey. Yeah, I've got a couple questions for Brad.
Okay, go ahead.
Okay. Yeah, it's a little interesting because the YouTube is 30 seconds behind my phone. So anyway, okay. So there was obviously it's up to council, but there's different caps, $50,000 cap or whatever cap the council wants. Is that per project, or is that per customer per year? In other words, would a particular developer be capped at 50,000, or is that each project that developer would do?
Yeah, so that would be tied to each permit. So these CETs are calculated based on a permit basis.
Thank you. So we saw that the projection for this year would have been like 486,000. And what was the total number of permits, both, or if you could break it down, residential and commercial, what was the number of permits that created that potential amount of revenue?
Counselor, I'm going to have to look that one up. I didn't have it in my notes here. You're asking what the actual residential permits that we use to base that estimate on?
Yeah, how many were there?
Yeah. Yeah, I apologize. I just have the valuation with me right here. We have that number. I just don't have it right here at the stand.
So then a question that kind of ties with that is the number of permits and how many unique customers does that actually represent? In other words, how many, because one contractor might have done 2 projects in the year or 10 projects or whatever it is. So how many unique contractors or customers created that number of permits? I would also like to know.
Sure. Yeah, that's a fairly easy calculation. We can certainly get that, but yeah, your home builders that do multiple permits, they would be assessed this CET for each individual permit.
Yeah, I was just trying to get a sense of how large the class of people here is, as far as the number of people that would be paying into this tax. And that's why I was kind of looking at the number of unique customers, unique contractors. But you get the pick. You get what I'm asking for.
Sure, we can get that for you.
Thank you. Thank you.
All right, Doug, I think it's...
Wait, hold on, this is Valerie.
Hey, Valerie, go ahead.
Okay, so I had a couple questions. How long has the school district had a CET?
They've had it implemented for a long time. I don't have the date, but I think it's been over a decade for both of those. It's been a long time.
Okay. And is that specifically targeted to how they can spend it?
Yeah, it's for their school. There is requirements just like there is for us. It is a funding tool for their, I think, school facilities.
Is it construction? Is it the same sort of thing? Is it for them to construct new facilities? Or no, you don't?
Brad's looking up some of that information. He might be able to tell you more specifics.
Okay, and I just wanted to clarify that this is for construction, so this isn't for buying a house or anything. It's for people who are buying new houses or remodeling above 30,000, correct?
This is permit-based, so this isn't related to MLS or homes on the market or anything like that. This is strictly related to individuals that are coming in or businesses that are coming in and applying for a permit through our community development department.
Okay, thank you.
Counselor, this is Brad. I'm just looking at the ORS 320.173, and this is what tells school districts, sets the parameters. They can only be used for capital improvements, but that includes acquisition of land, construction or reconstruction of school facilities, acquisition of installation of equipment, furnishings, or other tangible property. They can use it for architectural, engineering, legal costs, and other obligations related to finance capital improvements.
And, all right, thank you. Well, what is their rate, just out of curiosity? What is their percentage?
So they have a little different calculation. School districts are based, they're $1 per square foot on structures for residential, or 50 cents per square foot for non-residential. So they have a different calculation.
So we can't do it square footage. We could do it percentage. I guess that's
correct.
it's probably pretty easy. Okay, thank you.
Thank you. Joel?
Doug, while you're there, without wearing you out by standing up there, what was the committee's recommendation on this a couple years ago, and what's your relationship to it and how you feel about it?
Yeah, so the committee was tasked, the 4 years ago when we were started, our first task from council was to look into the construction excise tax. And so we did about 6, maybe 8 months worth of research, which included interviews with builders and developers and real estate agents at the time. Most of those didn't like the idea. It was generally speaking, something needs to be done, but just don't do it on our backs, was sort of a paraphrasing most of the builders. There were 2 that thought something needed to be done, and this was as good as anything else. That was Bill Lovelace and Kelsey Osland. We spent quite a bit of time trying to figure out the sort of fine-tune the best way to make a recommendation to you about maybe a third of a percent here and then anything off of square footage, and trying to find a way of chopping this pie up to accomplish more than just collecting money. I don't know if I'm making sense here. We spent a lot of time doing that at the committee level, and it ended up sort of being a waste of time because we got done with that after a couple of meetings and then looked at the dollar amount we would have generated, and it was sort of a waste of time, $150,000 for all the effort staff would need to do to implement all of these little tiny pieces of pie. We'd take money from here and do something like that. So then we backed off and said, well, what's going to generate $400,000 and just make it a blanket easy. And so our recommendation to council was to adopt a CET and to do it at the rates that Brad brought up. That was our past recommendation, which was a 0.5% and a 1%, is what we recommended.
Well, we've never let Doug speak, so does somebody have a question for Brad before we go to Doug? All right. Sorry, did you have something else you wanted to say to us, Doug? Okay.
No, not really. No, Brad covered it all, and then that little bit of history is probably the only thing I could add that was much value.
You. All right, go ahead, Brian.
Yeah, I just had a question for Doug or Brad.
Yeah, I'm sorry, Sarah. This is Rob.
Hang on just a
I
minute.
have a question for Brad.
Okay, I'll let you go
I have
after
a question
Brian.
for
Rob,
Doug.
can you wait till Brian's done?
Sure.
Thanks. Brian, go ahead.
Thanks. I thought I remembered seeing something previously with a different percentage recommendation. I don't know when or where it was, but I thought there was maybe a 0.75% on residential. I vaguely remember seeing that on a slide at some point, and I didn't hear it mentioned. So do either of you remember that?
No. What I recall from my really bad memory of 3 or 4 years ago was that we presented, when we made the motion, we presented a table of this is what would happen if we did X's. We recommend this, but these are the options, or these are potential options for you. So that may have been what you saw, but I really don't recall, and I didn't have time to do any research on what we had recommended before I came here.
Okay, thank you.
Okay, Rob, go ahead.
Thank you. Kind of along the same lines, I think that maybe what Brian just mentioned. I'm just wondering, Doug, how, if you remember, how you determined that 1% would be reasonable for commercial, but half of that would be reasonable for residential. Like, why was there a differentiation?
I don't recall the logic. I think it was, I don't recall the logic on that.
Thank you.
Is it fair to assume that the cost would be passed along to the home buyer, and that perhaps you were trying to not overly increase our already unaffordable housing problem?
Yeah, it could have been that the individual homeowner, home builder, permit purchaser, we were more sympathetic or empathetic to them versus the commercial developer.
Do you have any other questions, council? Valerie, Rob, any other questions?
No, thank you.
Okay. Move along to council discussion. TJ.
So it's been recognized in communities like Bend and Eugene and Corvallis that the construction excise tax has been a very useful tool to help promote affordable housing. Something that hasn't been recognized is they have a wealth of land that they can build affordable housing projects on, and therefore the construction excise tax helps subsidize affordable housing. I believe that the problem that we are having is primarily facilitated by a lack of affordable, or not affordable, by a lack of buildable lands inventory. Property is very expensive. It's unprecedented how expensive property is. The reason property is so expensive is because there's not a lot of it out there. If you want affordable housing, the number one thing that needs to be done is create more available buildable lands inventory. And until that's done, I don't believe that subsidies or taxes or otherwise are going to help the housing crisis in an appreciable manner. That being said, I don't think the timing for this is ripe. Yes, we have a crisis, but as I mentioned before, hard costs of building and land costs are unprecedentedly high, and this will just make houses more expensive. Another point I want to make is just because the state says that a city can implement a construction excise tax without a vote of the people or taxation without representation doesn't mean we necessarily should. I think if the council wanted to entertain something like this, then a wise move would be put it on the ballot. Speaking of the ballot, what about a affordable housing levy that everybody can pay into it, or some other resource, if you will, for revenue? Because what we're talking about here is taxing developers, which are the class of people that need to be relied upon to build the houses that we need to respond to this housing crisis. And if we want to incentivize developers to come into here, I think it's inappropriate to increase the cost of the house. So what we have is council sees a problem. We have a housing crisis. We need to respond to it. And it sees a revenue. And it's entertaining that this revenue source is going to solve this problem. I'm of the mind that it will not solve this problem. We had a discussion at our agenda setting meeting, for example, that I could use. We have ARPA money. Let's say we take $3 million of that ARPA money and we tack on the $1 million sale of Ramsey, Nebraska, and the city has a $4 million pot of money for SDC subsidies or affordable housing subsidies or incentives otherwise. I don't even think that's enough money at this point, given our buildable lands inventory, to make an appreciable difference in our housing crisis. I don't think the timing's right. I don't think that there's an amount of money per se that can be sourced to make a difference. And the problem is all over the place. The problem is rentals, affordable housing, expensive housing, opulent housing, middle housing. It's all needed. And focusing on affordable housing and subsidies using a construction excise tax is inappropriate at this time.
Brian?
I don't
No,
think
I'm
so.
sorry, it's not open to the public.
So the housing crisis is not new. The housing crisis has been here for a long time, and it continues to get worse. The city and housing committee has been kicking around the idea of a construction excise tax for 4 years. And I'm hearing the same tired arguments about why we shouldn't be taking every action we can to help solve the housing crisis. This isn't the only thing that we can do, and it's not the only thing we should do. We should be doing housing committee has a whole list of 30 things we should be doing. This was the first one they recommended. This was the first one they looked at, and we haven't even done this one yet. So I'm in full support of this.
Vanessa?
I am sorry, workshops aren't normal, they're not open for public comment, but we would like to hear what you have to say. If you would email the mayor council at grantspassoregon.gov, we would love to hear your comments on this topic. And I did want to reiterate that this is a housing crisis that we need to take multiple approaches to. It is a multifaceted problem. It's not, we cannot take a single paintbrush and stroke the problem away. And I think that this is a step in the right direction. The housing needs analysis from 3J Consultants did recommend a construction excise tax, as well as what's been previously stated. The Housing Advisory Committee has recommended this since October of 2018, and it did make it as well to the work plan that Councilor DeLaGrange had mentioned. I did want to reiterate from the housing needs analysis that they do estimate, the consulting group estimated that we'll need 1,554 units of middle housing in the next 20 years. And that's about 77 projects a year to keep up with our population forecast. And this is something that simply will not be done without a legislative and incentive push. With all of that said, I do support moving forward on the construction excise tax.
DJ?
So we have a recognized expert in the development community here that I would be in support of having her talk today. She's not just a member of the public, shouldn't be treated as such. She's a leader and an expert in development in this community.
We don't generally allow public comment during workshops, and this has not been presented to me ahead of time, even though there's been ample opportunity. This issue will come up at a business meeting if council decides to move forward, and that would be the appropriate time to accept public comment. Council, any further discussion?
Yeah, I have something to say.
Go ahead, Rob.
Thank you. I appreciate DJ's point about the buildable lands inventory. That's a critical piece that probably has not been on, my radar often enough. But I also, I also think that if the fund were to grow for a few years, as we were acquiring or generating more buildable land, then I don't necessarily know that I don't think that's a bad problem to have. We'd be just all the more ready to actually make a major impact. The other point too that I'd like to make, it kind of gets back to a question that I asked Brad, and I just did some quick arithmetic. If there was roughly $25 million worth of residential housing.
Hang on just a second, Rob. Hang on, let's see if we are having a feedback issue. Okay, go ahead, Rob.
Thank you. If there was roughly $25 million worth of residential building done, and I just picked a figure of $350,000 for a house, that would have meant there was about 70 permits issued to achieve that, which I really don't know. DJ might know, but that might have only been, 25 developers. And the point that I'm getting at is I just don't feel it's appropriate to put something on the ballot that really only affects directly 25 or so people. I would certainly never put the safety levy, needs to go to the ballot because it affects every single home in Grants Pass. To me, fire district, sales tax, things of that nature that affect literally everyone need to be on the ballot. But a matter that affects, and I guess, the argument could be made it affects everyone, but directly affects who'd be writing the checks. It might affect 25 contractors, and maybe it affected 70 purchasers of those homes. I just don't feel that rises to the level of something that should be put on the ballot. Thank you.
Thank you. Valerie, go ahead.
A couple things. Number one, I want to piggyback a little bit on what Rob said. because annexation right now has to be put on the ballot, which is another tool that we really need to take a look at, which has to do with buildable lands and bringing in people and bringing in more land availability. The UGB currently in 2014 is when it was brought in, and I would be interested in knowing exactly how much of that land has actually been developed since it was been brought in 2014. I would venture to say it's very little. So our last, UGB brought in land that is still sitting out here 7 years later, waiting to be built upon. And part of that problem has been ODOT with the way we went about trying to get it rezoned. It came to my attention just recently that the annexation that we currently have, that there are a number of people out in the community who have bought in and have to service the city services and can't vote. I mean, how many other people are out there that might be able to, I don't know. It just brought up to my attention that there's a whole nother issue out there just sitting there that we need to explore. I'm also very frustrated at the lack of housing that has happened in the last 7 years in terms of, and the CET tax that has been brought up multiple times. I know, and I was going to say Gail Atkins, if she's in the audience and she would be the one to speak, she has a tremendous amount of knowledge about the building in our community over the last 10, 15 years, because she's been a realtor, a developer, and so I would really like to have her speak. The piece that makes me, in a way, want to support the CET tax is that it's on building. We need to open up more property, and if people are building, then that will open up more housing from beneath as they come in, and so, that's kind of a two-edged sword. On one hand, if it doesn't create the builders from stopping and people want to come here, which obviously people are moving here from California, it would be interesting to know the percentage of people buying new homes in our city, whether they are people from within our city or whether they are people moving in from another community. Because I think people moving in from another community don't blink an eye at a CET tax. Who does is our local community who is struggling to find housing. So like I said, I'm not sure which way. I think in a sense I am leaning towards some sort of a CET tax. I would like to see $3 million of our money go into that fund. I don't have a lot of confidence that AVS is going to come to the plate anytime soon. So I would like to see part of our ARPA money go there. But that, once again, we need something that's sustainable, as Vanessa brought up. This isn't just a one-stop, we're going to fix it. It's going to take years to bring us up to the level by which we can bring our housing to where it needs to be. So I would like to have the opportunity I would put my support to have Gail speak, because I think she has an incredible amount of knowledge to share on this topic.
I'm going to second that. If you guys actually care what the development community has to say about this, you will let Gail come up and tell you about it.
Go ahead, Brian.
Oh, I just wasn't sure if that was a motion from Valerie or what.
Well, we generally do not.
I will make a motion.
Second.
All right, well, we know where the two of you stand. How about you, Vanessa?
Yes.
Kurt?
Sure.
Joel?
Yes.
Brian?
No.
Yes.
Well, I'm just going to point out, for the record, DJ, that you and I have had arguments in the past before about people being allowed to speak,
Gail,
and this opens that door.
sounds to me like a motion
But
to
Gal,
pass
Point of order.
please come forward.
Point of order. Is the red light on?
Yes, it's on now, okay? So it's been an incredible meeting, and my eyes got blown open by the medical situation we have. But we knew it, but it was really popping. And then we talked about climate change, which is incredibly important too, and emissions and forest. And by the way, I'll be bringing a project to you guys that has an urban forest, I hope, in the next month. So I really care about all
Let's stay
this
on
stuff.
topic, please.
Oh, sure. So it is kind of the topic. I kind of just want to say what Dwight said. We need more land. And taxing new homes, so I live in a 70s house. My energy bills are around $260 a month. The new homes I'm building for my clients pay about $50 to $80 a month, including air conditioning. New homes are good for the environment. They're good for people. They create jobs. And Valerie's question about who's buying these homes. So I have 4 of them in escrow now. 3 are local. We have a fireman, we have a nurse, teachers, a home health care worker, and a new pediatric surgeon trying to move to Grants Pass. We haven't had enough homes to get new surgeons to move to our town. So raising the price on those people is to me, is incredibly unfair and targeted. Yes, somebody commented, should it go on the ballot because it only affects a few? Well, yes, because how do you have the right to tax only a few for a community problem? The housing crisis is real. I encounter tents when I go look at land and I find people out in the woods, and it's frightening because of the potential for fire and other things along with that kind of housing shortage. On that topic, I want to say I also support the city buying land and creating a tent zone or a camping zone for safety reasons, and because we have a crisis and people can't afford. So there's lots of ways to solve the problem. I don't think targeting a tax, and you said only 25 developers. There's really only 5 or so developers, but there's probably 1,000 people that work in the industry. I don't know, I haven't counted. But, we're kind of like punishing the people that are working to solve the problem every day and struggling right now to even find products to build with. So I've been doing this a long time. If any of you have any questions, I could say a lot of things. I could be here till the gong goes off and you pull me off. But I just am really, really oppose an excise tax on new homes. And I also want to say, for those of you that thinking like single-family homes, kind of luxury sort of homes, it's not, because there's no single family anymore. We have ADUs allowed on every zone, so in the reality, a 1,500 square foot house can have 5, 6 residents in it, and then they can have an ADU with 2 more. Grandma and grandpa, uncle, aunt, whatever, they can rent it. So so a new home can create housing for easily 6 to 8 people, easily. And that's what I believe is going to happen. And I've been doing this business a long time and watching the trends. So the other thing I wanted to mention, besides we need more land, we need to get this stuff in, we need to get Allen Creek done, we need to get more things that are already in the works finished. But I lost my train of thought. I think the ADU idea is a good one. It's really practical. We should encourage that, make it easier, streamline it, just make it easy to get that permit. And let's see, does anybody have any questions so far? I have so many notes I could talk for a long time. Want to hear about the buyers, what they're going through?
Brian?
I'm just curious, is there unlimited? Is it 3 minutes? And where are we at here?
I'm fine.
I don't know.
You're done.
Leave it to the council to make the rules.
Unless somebody has a question, I'll step back.
Thank you. This will come up again. You'll have more opportunities to provide comment. Vanessa?
I wanted to clarify a talking point I've heard a couple of times, that earlier this year in our land sufficiency analysis that was done, it was actually indicated that there is a surplus of 478 acres of buildable land. That is under the condition that developers adhere to the zoning on the land in which they are developing on, which we know historically has not been done. So that is the root of the problem, is that minimum densities are not a legislative push from the council at the moment. It is not, it has not been ratified, so that is also a root of this problem. There is enough land, we just have to build according to the land that you are building on as well. I think it is extremely unfair to say that the council, if the council had not moved to allow a member of the public to speak at a workshop, that they do not care about a niche's concern on the topic at hand. I think that we can both care about that niche's concern and follow meeting procedure.
Brian.
Yeah, I'd move that we take a CET, the topic of the CET, to a business meeting for further discussion and a potential decision.
Do you want staff to prepare an ordinance or just move it for further discussion?
I would have staff draft up the ordinance that could be adjusted as needed at the business meeting.
Okay. Is there a second?
Second.
Thank you. Any discussion on the motion? Rob and Valerie, did you have anything to say?
Nothing to add, ready to vote.
Thank you. Okay.
I'm fine.
Thank you. Okay, Joel?
So are we at discussion now?
Yeah, there's discussion on the motion, which was to direct staff to prepare an ordinance for a business meeting.
Okay.
Go ahead.
Thank you. First off, I would like to compliment the council for dealing with each other with respect and dignity and listening to each other. And yes, they make the rules, and the world's not ending. We're okay. One of the things that struck me was Doug recommended, and his committee recommended, that we adopt it. And the other thing that struck me was Bill Lovelace supported it. And with those two things, I will be voting to direct the staff to prepare an ordinance to adopt a CET program.
That's right. Yeah, we're just moving it forward, voting to move it forward to a meeting, not voting on the tax itself. Any further discussion? All right, Brian, you may.
I will just add.
I've got one thing.
Okay, Valerie, then Rob.
Okay, I was just going to say that at this point, I think we need to move it to a meeting.
Okay. Was that all, Valerie? Okay, kind of sounded like she got cut off, but she said she supported moving it forward. Rob?
Yes, I'm not sure if this is the exact right time to mention this, but if we move it to that meeting, we've heard before when we did our budget, our budget project process, that basically the building industry is subsidized by the general fund. In other words, the general fund, the fees don't cover the actual staff costs for that. And I would just like to know, when we go to that meeting, exactly what those costs were again. They told us a few months ago, and I forgot, but I know builders right now are subsidized by the general fund, so I'd like to know to what degree. But I'm also in favor of moving it to a meeting.
Okay. I'm not 100% sure on your question, Rob, but maybe you can email it to us or to Aaron later so that staff can follow up on that for you, okay?
Yeah, thank you.
All right. Any further discussion before we vote? Okay, Brian, I believe you made the motion.
Yes.
DJ?
Yeah, let's keep talking about it.
Valerie, Vanessa?
Yes.
Kurt?
Yes.
Joel?
Yes.
Valerie?
Yes.
Rob?
Yes.
Okay, we're going to move that one forward to a business meeting, and the public will be welcome to speak at that time. And you can also email us at any time at mayorcouncil@grantspassoregon.gov.
I do. I just wanted to mention, Rob, I understand your question. I know what you're talking about. You're looking for at what point is general fund subsidizing community development based on the fees that we receive also right now. So we'll get that percentage.
Exactly. Thank you. Yeah.
Okay. So we are going to skip the Long Ridge, Washington Conservation District today, and our next topic is Injunction Park impacts.
Sarah, could you have them mute?
Yeah, Rob, it sounds like if you could mute, thanks.
All right, good afternoon again, Mayor and Council. Brad Clark with Community Development. So this presentation's a little bit different than some of ours. This is primarily oriented to information to give to the council so you can better understand where we're at with the level of service that we're providing in our parks as it relates to the homeless injunction. So this is an informational presentation to give you an overview on that, and particularly how it's impacted some of our services and budget. It relates to your council goals to provide cooperative shared leadership involving council, staff, and community. So here's how we're going to work through this, clarifying the presentation purpose, giving you just a brief overview of the Blake versus City of Grants Pass case, impacted parks, which parks in particular are we seeing impacted, and the areas of impact, maintenance and sanitation, budget, and then some comments on staff retention and morale. So as I mentioned, this is informational, really just to help keep the council updated on staffing and service delivery to the parks. There is not a specific call to action today. And we definitely as staff want to underscore our understanding and belief that public parks are intended for everyone to enjoy. So some of the photos and things we're going to share today, are a bit troubling, but by no means are we indicating or inferring through this presentation that we think that we should change how we address parks in terms of access. They should be welcoming space for both the housed and the unhoused. But the challenge is that they weren't designed to provide certain services for our unhoused population. And so I think some of that will, kind of become clearer today. So that's really our goal, to share some of those challenges and the impacts that the court injunction is having on us. So I think you're all pretty familiar with this. I'm not going to read these, but this is the case of Blake versus City of Grants Pass. Related to the Eighth Amendment provisions. The court did enjoin the city from enforcing certain ordinances against the homeless class related to park exclusion, camping, and trespassing. It does not apply to Reinhardt Volunteer Park, but it applies to all other parks. It does mandate that enforcement of the camping prohibitions and trespass do not occur between certain hours. And then here's just a little bit more explanation on that. Specific to the park exclusion ordinance, we are enjoined from enforcing the camping ordinance without first giving a warning of 24 hours. And then the hours specifically are addressed there. There was a couple of changes that the council made to extend hours for allowable camping during the winter months. And council provided for extending camping with 2 or more consecutive days of 100 degrees. That's the most recent change. And then House Bill 3124 was passed. That does increase the time from 24 hours to 72 hours that written notice must be posted before removal of homeless individuals or their belongings from their established camping sites. And it does require written notice to state how the individuals may claim personal property removed from the camping site. And also requires that unclaimed personal property be stored in an orderly fashion. And of course, we have the chief here today who can answer more specific questions about that. So as far as the parks themselves, we're really seeing the impacts on five parks. There's some scattered throughout them, but really Riverside, Gilbert Creek, Ogle, Debo, and Baker are the main ones that we're seeing some impacts. And those are shown here on the map. Hopefully you all know where they're at, but Gilbert Creek shown there at the top, and then kind of moving down through Ogle, Debo, Riverside, and then Morrison is shown on the bottom. We are seeing some impacts at Morrison, but today we really kind of decided to pull it back and not really talk too much about that. Just a few photos. I think, you know, the main impacts are going to be shown here on the left side of these screens. Riverside has received, of course, the most attention for us in terms of the media and comments to the council. We're just seeing lots of garbage, lots of trash, graffiti, hypodermic needles, and human waste are showing up. And so really, you know, this means a shift in how staff are investing their hours out there. You know, there's the top photo there is showing underneath the bridge. That's technically ODOT right-of-way that's underneath the bridge, but you know, it's connected very much between the east and west sides of Riverside Park, and so we are still doing some work in there. We've seen here in Riverside Park some fires, some small fires, which is up there on the right-hand side. That top left picture just shows just a new trash can that we added. There's been a few of those added in there. What's not shown here are a larger dumpster that was also brought in. In terms of Gilbert Creek, you know, similar issues. What's happening at Gilbert Creek more recently, we have the structure up there where Rec Northwest has been operating their office out of until just last week. And there's, you know, an overhang there, and so it provides an opportunity for shelter. And so we have seen a number of unhoused populations kind of gathering there. And so that there's been some irrigation vandalism at the Gilbert Creek. You know, this broken down vehicle that you see there, that occurs really at all of our parks. Ogle, one of the smaller ones, really garbage and graffiti are kind of the two main issues that we're dealing with there. Debo Park, maybe one of the more visible, especially if you're in the downtown area, right there next to Dutch Bros headquarters. We're seeing some damaged landscaping had to be repaired over the last year and a half or so, as well as lots of pickup of trash. And then Baker Park. There's also quite a bit of restroom damage. That's another one that's been added here that's been having to be repaired there at Baker Park. So as you can imagine, I mean, this is really focused on maintenance and sanitation. That's what's adding to our staff. Some of the specifics related to that, we've had to relocate and kind of shuffle where they do the cleanup work. That includes things like meeting with contractors that they didn't have to meet with before, versus doing the mowing and the trimming and the pruning work. We've seen a lot of impact on the toilets. That's been one of the main areas, calling in plumbers in terms of outside contractors and working with them. Our crews do estimate about a tripling in the amount of labor and plumber time compared to 2 years ago, which was about the time that the lawsuit kicked in. Things like removing electrical plates to tap into the power supply and broken plugs and having to go in and fix some of those, rebuilding locks on restroom doors. We saw in one park where some wires were ripped out from the irrigation valve boxes. And so now we have to, you know, our crews screw those closed, and so anytime they need to go in and do repairs on those valve boxes, they need to unscrew that in order to get in and do the repair work. So those are just a few examples. I should mention we have Ken Garrison here today. He's our parks supervisor, intimately involved and familiar with all of these issues, and he'll be able to share a couple of stories with you. So as far as the budget, overall, we got about 90% of the parks division budget is focused on maintenance. Most of that revenue, 92% of it, comes from the general fund. Just drilling down on that piece, the contractual professional services line there, this fiscal year we're working with 1.2 million. There was a decrease in that line of about $34,000 for this budget year, largely focused on trying to reach that $2 million deficit figure and address that in part through that line item. So that specific line item includes really where you see a lot of the maintenance work and the cost for the plumbers and things like that. The contractual amounts that are there, the professional services, and here's the more specific breakdown of what that line item incorporates, everything from janitorial to the landscaping contractors, the plumbers, the electricians, and then some staffing there, vandalism repairs that are outside of what staff can do. We typically do go out. For example, this morning we did have to go out and close the skate park because of some graffiti. So it's closed right now while that's being cleaned up. That kind of work we typically can do, but there is some types of vandalism that we have to call in specialists. So that comes out of that line item as well. So the biggest impacts that we're talking about is really diverting some of these contractual funds from our more routine duties to these other items, the plumbing, the electrical, the irrigation repair, pressure washing the shelters and the pathways is a particular one that we've seen a big increase in. Cleaning those up because of the human waste. Again, that's been a big change. We've seen the increase in the garbage and the sanitation services as well. Then the last item we wanted to bring to your attention is related to staff retention and morale. We have seen increased complaints from park users, so our on-the-ground front, people that are on the front line are often the ones to hear and communicate with the public. That can get wearing after a while. The job duties that shift from park maintenance to sanitation work, reassigning public safety personnel from downtown to parks. I think the chief has a few numbers on that in particular that he could provide for you. Then just kind of the day-to-day uncertainties of dealing with this. We have received an increase in that concern coming at us, from staff. There's been pranks. And these last two are just kind of quotes that come from a couple of our crew. And one says, "Please do not relocate me to Riverside. I would quit." Another one says, "I'm sad that people don't feel safe bringing their kids to the park." So that has an effect. It'll just kind of running through. I think ending on maybe a little bit more positive note is that we have not seen a large number of them leave. As you know, Wendy Giordano did leave, and this was certainly not her only reason, but it does add to the reasons. At this point, the impacts, especially when it comes to morale, are I think we're dealing with them, and we're giving opportunities to communicate and have an opportunity to have input on management and opening up those lines of communication as much as we possibly can. So just a few final acknowledgements. Vandalism, graffiti, and littering occur in all of our parks, including Reinhardt, which isn't part of the lawsuit. So it's not being attributed solely to the unhoused by any means. Grants Pass is not alone in striking a balance between this. This is a challenge that that, you know, parks, facilities and districts across the country are dealing with. Most park users are considerate. Most park users are respectful of public property. And so this is focused on the positive here, that, you know, we have a lot of people that just really enjoy and give compliments to our city parks. And then that last bullet there, I think I just already touched on. It's, you know, while stressed, and especially during the pandemic and some of the heat conditions, we continue to do our jobs and hold to the high standards. So at this point, I think I'm going to ask Ken if he could maybe come up and just from our park supervisor standpoint and, you know, managing the crews and kind of dealing on a day-to-day basis, if there's anything else you want to add, Ken. And
I just want to add that we are going to lose staff if we don't try to rein this in, without a doubt. I have a staff member, those quotes are real. I have a staff member that said, if you rotate me into Riverside, I am out of here. I'll give notice today and be gone. It's a sad reality. It's not just here. I think I played softball in 34 states. It's everywhere, but we have to try to do something. I don't know what that is. I don't know what the answer is. We're wasting, Riverside Park, I estimate 1.5 to 3 hours a day just cleaning up after the homeless. The folks that live in their cars, they rummage through them every day. I don't know if it's mental illness or if they're strung out or whatever, but they just leave half of their belongings behind and move along. And we come back and we're having trash cans filled as soon as we empty them. 10, 15 minutes, they're filled again, and all the stuff just laying around them or in a parking lot or wherever. The needles and feces are daily, every single day. Thank goodness my staff member that is at Riverside is, as I say, he is a saint. He's on vacation right now because he was on the verge of losing it. So I'm glad he took one, but he's been a trooper through this whole process. So if you folks have specific questions, I would love to answer them. I could tell you some of the horrible details of what we see on a daily basis. If you want to hear them, I'll give them out, but questions?
I have a question. I think, do you think if we added some portable toilets and additional dumpsters in key locations, it would help?
I think dumpsters would help. Key locations, no. We've added trash cans and they don't use them for the most part. The people that are using trash cans are just our everyday folks. A few of the homeless people that are living in their vehicles will use trash cans, but the majority of them do not. So dumpsters help. And I have recently added one at Riverside. In the last couple of years, we went from having a 6-yarder dumped every day to dumped 3 times a week. We recently just added a 4-yard dumpster. They finally got something larger than a 1-yard dumpster to bring to us. So that was a big help. And that's being dumped once a week. Portable toilets, at this point, I say yes. In the beginning of all this, I was a hard no. At this point, they're going everywhere. If we lock a restroom, they are defecating everywhere.
So, Mayor?
Yeah, I want to comment real quick, please. So I would rather, and I strongly advise we don't venture into talking about additional services at that point. That would be an executive session type discussion.
Okay.
Okay. I lost my train of thought there. I guess, what do you feel would help your staff?
Say it again.
What do you feel would help the staff?
You know, honestly, at this point, I'm lost. I had this conversation with Brad and with Diana and briefly with Aaron. I don't know what to do at this point. This is where you folks have to come in and help. I don't know what's going to alleviate this. We're eating hours every day, not just at Riverside Park, at other parks, and I look at everything in hours. If I'm losing a couple staff hours at Riverside Park daily, that turns into 1 day a week I've just lost. You know, if I'm losing 2 hours a day on average, I just lost 10 hours of staff time that I don't have. And that's at one park. We've had issues at Ogle. We've had issues at every park, honestly. Those are the worst ones. I have a female staff member that gets sexual comments all the time out of these folks. She doesn't feel safe going to parks. I've had conversations myself with some of these individuals about how inappropriate that is. They're getting into valve boxes and pulling valve wires out so irrigation won't run. Even when we screw it down, they still get into it. They rip lids off. I'm at a loss. And I've been doing this for 19 years. So it's a struggle right now.
Joel, then Brian.
I had a couple thoughts. What we found in the outdoor recreation area, the more facilities you have, the worse mess you get. And you look at Union Creek, it's, at that time, $300,000 bathroom. We finally went to pack it in, pack it out, and we took away all garbage cans. Of course, that's the wilderness ethic as well. But so the expectation is if you're going to recreate here on federal lands, you pack it in and pack it out. If we put waste baskets there, you couldn't put enough of them, and they would never make it to the waste basket. Same thing happens with the toilets. I mean, the toilets are just, it's not just in the park, it's on federal lands as well. And I would go with the person to clean up the toilets. And by the way, do you guys get shots for hepatitis?
It is an option.
It's an option.
Staff doesn't have to.
I would take a hard look at that. And, you know, I'm not here to dictate that, but health is important. And I know before I had to clean up bathrooms, I had to get a hepatitis shot, the public restrooms on federal land. So anyway, the other thing is solutions. First off, you know, a federal judge doesn't run public Grants Pass parks very well. They don't live here. They respond to some of the local groups that were in a power struggle with the past city council. They won that power struggle in court. There was a injunction by a federal judge who took over the parks. And so the policy that we set here really is set by the federal judge. So we need to recognize that and respect it. And is that going to be a permanent solution? Is that the way we want 10 years from now for that to be? Do you want the federal judge to run the water treatment plant? You know, I mean, the answer is obvious. And we need to be respectful of all members of our community. That's a given. So we need to somehow have a strategy that manages, because right now we don't have that authority. Okay, the federal judge does, and he doesn't even live here. How we do that, I don't know. I was going to talk to some of the local groups that brought the lawsuit and brought ACLU in to balance the power struggle with the last city council, because power became more of an issue rather than the substance. And whenever power becomes the issue, the substance is lost, the homeless suffer, the public suffers, and it gets worse and worse and worse. And so you look at the trends, 10 years from now, what does it look like? Left to the same conditions. We end up, like where I grew up, all the rivers became slums. And the property values were destroyed, and but you know, it happens over a 40-year period. It doesn't happen in the next 2 years. Okay, so the other opportunity we have, and Brian, you can disagree with me, and that's fine. A lady came to me, well-intentioned, and wanted to, she has a group of volunteers. And I don't know the city's volunteer policy. I would think we would want some kind of policy that would either provide liability or not liability for these folks, but in some organizational status that they would have to sign up and that the city administrator would have to approve. And it would supplement the cleanup, maintenance, things like that, perhaps even tree planting. But there's a group out there that is interested in doing that, and a lot of outdoor recreation organizations have a nonprofit like that supplements, and they have to follow what you say. They don't do their own thing. So anyway, she's interested. She's probably going to come before us. I think it's probably, it's part of the solution. It's citizens taking interest in their own resources. And I don't know where that'll go. But anyway, thank you for what you do. I talked too long.
Brian.
Thank you, Joel. Thank you for bringing an idea on how to solve it, because I've been hearing a lot of what the problem is over and over and over, and I'm glad you finally had a recommendation, so thank you. And I think that's what this conversation should be focused on, is solving the problem, not rehashing the problem again and again and again. So if we need to go into executive session to do that, because that's what Mark says we need to do, I know we probably can't do it today because it's not noticed, but I would recommend we do that next week and get to solving this problem.
Thanks. Anybody have any questions? DJ?
So, my question would be about kind of the general job description of your staff. Is it just generally presumed that they're going to handle sanitation efforts? Because I imagine before this, some sanitation efforts might have been pursued, just happenstance or whatever. But those, I guess those incidents have increased, obviously. So is that well described in their job description, staff expected to handle sanitation efforts?
So our staff of parks, grounds, maintenance, we do have light electrical, light plumbing involved in that. We do have some trash cleanup, but I would say in my years here, it's only grown. And the last couple years have been by far the worst. These folks, they don't care. They really don't. For whatever reason, they don't. It is what it is.
So generally, it's not really in the job description or expectation?
No, we sub it out. We sub our janitorial contract out, helping us empty trash cans. That's not to say that we don't do it, because when my janitors this time of year that are running 7 days a week, when they leave there at 7:30 in the morning and at 9 a.m. someone makes an awful mess, it's either close a restroom down at Riverside Park or we deal with it. So we deal with it. For the most part. If it's real bad, I lock a restroom. My staff doesn't have time to deal with that, and that's not what they were hired for. So if it's real bad, we will lock them up and try to call janitor back at an extra charge, which they're bursting at the seams as it is with everybody having these hiring issues. They're in the same boat everyone else is. They can't deal with more.
Sure. So I guess my follow-up question to that would be, who's handling the brunt of the sanitation issues demonstrated in this packet, those pictures, for example? I understand we have a janitorial service, and you just mentioned that you'll handle it if you need it, but who's handling the brunt of that cleanup effort?
That's our staff.
Okay. Yeah. So I had a follow-up question for the chief. So how is, I guess, code enforcement for littering or defacing or graffiti or anything like that? Have you experienced a rise in enforcement issues in concert with this rise in incidents?
Before I answer that question directly, I think a bit of background is probably essential right now.
Take it away.
Just to share. And we're talking about people, so I want to try to be as caring as possible to everybody involved, because public safety is incredibly busy right now. We're dealing with a shortage of staffing ourselves, and our community response team, for example, that used to spend 80% of their time in our downtown district are no longer doing that. They're spending 80% of their time in the parks. And then when I have to remove them from their community response duties, it affects our downtown response to the parks. In fact, one of the officers shared with me that they haven't been down there in 5 days. And we've talked about this before, that consistency is incredibly important downtown. Also, too, we have to remember that we're treading lightly because we are under a federal judge's order to act a certain way. So we're still testing the waters per se. And we believe we are at the stage now to where we can hold people accountable to nuisance and behavior issues that we didn't before, that may in turn get them trespassed from a specific park because the appeal process is in place, but we'll give them an opportunity to go elsewhere. In preparation for today, I thought it was important to pull some data because the data tells it all. So,
Rob?
When we look at our
Is now exiting.
When we look at our parks, the biggest park we all agree is Riverside. So I pulled data from 17, 18, 19, 20, and 21, calendar year, knowing that calendar year to date is only 6-7 months, right? So in 2017, physical arrests, 57. 2018, 49. 2019, 56. 2020, 79. So far this year, 73. So we're busier than ever before in our parks. That's just one park. To be fair, there are other parks like Baker Park that are seeing a decrease because maybe individuals that spend time in Baker Park are spending time in Riverside Park. So I think that needs to be observed. So I haven't spent a whole lot of time delving into this data, but there's a combination of real information with anecdotal information from our CRT folks sharing that they're down in the parks 80% of the time versus the downtown businesses. And then I think about the class of people, and I think about other people cannot behave in the same manner because they're not part of this class action lawsuit. But then I think about co-occurring conditions, drug, alcohol, mental health, and the type of charges that we're arresting people for. And they're all over the map, Counselor, all over the map, from minor violations to assault 2, which is pretty serious. One of our officers was kicked in the head recently at Boatneck. And I also decided, well, let me take a look at addresses of people, because I don't want to judge people. But I do know that out of that 73 arrests so far this year, some had addresses of the park, others didn't have addresses, and others did. So it's a mixed bag. We're really not focusing that much on violation level stuff because we're so overwhelmed with criminal matters. And to be fair, Council, I need my guys out of the parks. We have a lot of stuff going on. I have about a 20% deficiency in staffing right now just in police because of FMLA, because of people we're trying to get into the seats, because of some of the officers that you all froze, to be fair. And it's concerning to me to keep our citizens safe and to keep our community as safe as ever. It's a big commitment. It's going to take the village to figure this one out.
Well, thank you for that very thorough response. Appreciate it.
Vanessa.
To follow up with your arrest data, Chief, do you know of how much of that is self-initiated activity and responding to calls for service?
I don't. To be fair, I do not. But I would guess, and this is a guess only, that it's not officer initiated because I think a lot of times our officers don't want to go down there. I'm asking them to do something that I might have a difficult time doing myself. They're feeling the same frustrations. But the great thing about the men and women of the city of Grants Pass is everybody has a heart. So we're always trying to get people into that wraparound service if we can. But also, too, not everybody's ready to hear it. So we try our best. Much like ballot measure 110 that decriminalized the use of heroin and methamphetamine, we still issue citations. We have the highest citation count in the state of Oregon, and people ask why. Because we're going to hold people accountable, we're going to hold ourselves accountable, but also too at the bottom of that citation, it has the 1-800 number for some sort of help. And I've been around addiction recovery for a lot of years. I served on the Addictions Recovery Center before, and I know that if people aren't ready, they're just not ready, and sometimes it takes 20, 30 times in and out of the system. It's a battle.
Thank you.
Any other
Sarah?
questions? Yeah, go ahead, Valerie.
I just had a question. I know it was a year or two ago, we put more money so that we would have more cameras in the park. In terms of vandalism and holding people accountable to some of those things, have those cameras been of any help?
It's a great question, Counselor. They've helped, absolutely. We have a lot of vandalism in general. It's not specific to a class of people. We get vandalism all over our city, and yes, they help. What has not helped is COVID, and everybody has a mask, so it's incredibly difficult to recognize people.
Joel.
So we got an imbalance between workload, workforce, and funding. And so the workload is bigger than the funding and more than the workforce can handle. So then the question becomes, how do you put those three things back in balance, right? Every business does that. The newspaper does that. Any business, you got to have a balance between those three, and if you don't, you have stress. And eventually employees leave, and you don't accomplish your mission and all those things. So here we have an increased workload with no increased funding, and actually right now a decreased workforce. So how do you fix that? Well, you can control the workload and say, hey, we're just not going to do these things, which, you know, if you're going to get it, if it's bothering people so much they're going to get a divorce at home and it's affecting other circles, you need to say that. That we just aren't going to do those things. And I heard somebody say that today, that we just don't have time to do that. The other thing you can do is you can increase the funding, or you can increase the number of employees or contractors. And whether we have the funding to do that or not in this temporary, hopefully temporary situation, because I don't want it to develop into a slum, to assist folks with, say, two more employees, or enough money for a new contract, or something like that. But everything else is just a window dressing. You got to have those three things in balance in your company, or it's not going to work very well.
Vanessa.
Thank you, Brad and Ken, for all of your work and your commitment to the city. Really appreciate both of you. I would also be in support of moving this discussion to executive session so that we can hash over some solutions.
All right, we can do that, and we will need to be very, very mindful of the appropriateness of having that discussion in a closed session. All right, anything more to say on this topic? Okay, agenda review. So we have a meeting coming up Wednesday evening with several public hearings. The first is to consider a motion to make an amendment regarding the transit hub restrooms, and to consider an ordinance amendment to Development Code Articles 12, 14, and 30 pertaining to social services facilities. We also have a public hearing for an ordinance that would amend Development Code Article 12, zoning districts, Article 19, site plan review, and Article 22, residential development standards. That one's just the second reading, so it would not have public comment. And a public hearing for a resolution to sell the 202 Northwest A Street property across the street from City Hall here. We also have council action to consider a resolution for an SDC credit for the Summerfield North stormwater, a resolution for a change order at number 3 J Street cleanup, a resolution to consider House Bill 2003 housing production strategy, a resolution for the Sobering Center financial assistance, a resolution creating a parking enforcement job classification, and appointments to both the Bikeways, Walkways Committee and Committee on Public Art. Any questions about any of that? And then next Monday's workshop is water treatment plant phase 1 design build-out services, followed by a tour of the J Street property at the end of the meeting. Also on the agenda is a business retention and relocation and system development charge grant programs discussion, and urban renewal agency program descriptions, follow-up on that holiday tree that we discussed last week, and agenda review. And I will not be here next Monday, so DJ will be running that workshop. And we need to get, can we do the executive session on Wednesday evening? Do you think, Erin?
We have enough time to advertise for that. I think it's important that you probably have your legal counsel present also Wednesday, and I'm not sure if they'd be available Wednesday night. I would need to confirm that, and if it is confirmable and they can attend, we can do that. If not, I can schedule it for the closest workshop or business meeting that legal counsel is available.
Okay. Is there anything anybody wants to add? DJ?
So as we mentioned earlier, the COVID emergency clause, I think that that's something that we should get the information about it. Brian mentioned he doesn't know about it, so he wants to learn about it. I'd encourage you to do so. If we can get a memo out, perhaps. I think that the time is of the essence. I think that we have an emergency, and having that as a part of the awareness effort. And I could actually see some potential for utilizing some flexibility of that funding from the city manager. I think that that's a very important step for our community. So however it is that we decide to handle that, get educated on it, implement it, I suggest we do that. One other separate issue, Valerie mentioned this earlier, I'm not sure if she's still there, but the current process for annexation, I would like a workshop on that and potential amendments we could make to annexation. So basically, it needs a vote of the people if somebody wanted their property annexed. I think looking into that city ordinance to try to either expedite or make that simpler seems to be a very clever thing to do for housing in the community. So those are two separate items.
Okay, we had already discussed annexation at our agenda setting meeting, but I'm not seeing it on the agenda yet, so make a note of that. Brian?
Yeah, I just wanted to ask DJ on the annexation issue. I don't know a lot about that, but is that something that was on the list of recommendations from Housing Advisory?
No.
Thanks.
All right, anything else? Aaron had something?
I was just needing some clarification on the state of emergency. Is council wanting us to go ahead and draft a state of emergency for the next business meeting? Maybe not this one, but the following Wednesday to declare a state of emergency and have that in the packet? Is that what council's looking for?
Is there a reason why we can't do that for this weekend?
That's what
this week?
I'd ask for, yeah.
Okay. I can have something drafted up for this Wednesday if that's what you'd like also. It's up. I just need council direction on that.
I think you need my direction, and I say yes.
Okay.
All right, are we ready to move on to executive?
Mayor, sorry.
Yes.
I just wanted to clarify, the tour is actually before the council workshop on Monday, so if we could meet over there at 11, we have a short 30 minutes for you planned. That way it's not happening after the meeting. I just wanted to clarify.
Okay, yeah,
Sorry
thank
about
you. I
that.
see that on there now. Okay, so meet at the...
Yes, at the J Street location.
Okay, and then you'll come back over here for the meeting. Okay, I'll entertain a motion to move into executive session.
I move to enter executive session.
Is there a second? Vanessa with the second. All in favor? Any
Aye.
opposed? All right, the council will now meet in executive session for the purpose of discussing those subjects previously noticed for this executive session, which is to discuss property, real estate. This executive session is held pursuant to ORS 192.660 and more specifically under the subsections of that statute which have been publicly noticed for this meeting. Representatives of the news media and designated staff shall be allowed to attend the executive session. All other members of the audience are asked to leave the room.